What is meant by pulse pressure? You all know systolic minus diastolic is the pulse pressure. Suppose if the aorta became very stiff, when the ventricle pumps little blood into aorta also, the pressure in the aorta, systolic pressure elevates dramatically, and the pulse pressure also will increase, is what need to be remembered. What is the effect of hyperkalemia? See, a chronic renal failure patient is there, doctor. Forget about chronic renal failure. You heard of hyperkalemic periodic paralysis, no? Why, when there is hypokalemia or hyperkalemia, both of them, why will they lead to development of paralysis? Did you get that doubt anytime? Okay, if you didn't get the doubt now, I will clear. See, when there is a hyperkalemia, it will cause the inactivation of the sodium channels in the skeletal muscle. Unless sodium channels open, there can't be depolarization. Unless depolarization is there, muscle contraction cannot occur. So it is the inactivation of the sodium channels in a hyperkalemic individual is the main reason responsible for the muscle paralysis in those who are having profound hyperkalemia, is what you have to ultimately remember. Shoot me an answer, doctor. That's right. For our earlier point, Varangal rightly said, named one law for what we describe in physiology. Okay. Now, what is for which condition is it a classical finding? Low voltage diffuse ST segment elevation. If you find on X-ray, what does it indicate? Vidya says aortic dissection, Dilip says pericarditis, Varangal says constrictive pericarditis, whatever it is, pericarditis. Low voltage diffuse ST segment elevation, multiple leads will show. ST segment elevation is what you have to appreciate. If there is a starvation, there is more ketone body formation, so that the brain can only live eating the ketone bodies for the breakfast, lunch and dinner. Now coming to the short and medium chain fatty acids, unlike the long chain fatty acids, they don't need micelle formation. That is the reason, suppose if somebody had profuse diarrhea, if a preterm baby, and all her intestinal mucosa got damaged, she is suffering from malabsorption. How will you treat her? You will give her with medium chain triglycerides, will be available as a special packet. You will feed them with MCT, because MCT, unlike long fatty acids, do not require micelle formation. So even if the people who had a damaged intestine or a malabsorption can still be able to absorb the medium chain triglycerides, is what you need to remember. Phosphoenol pyruvate carboxykinase, it converts phosphoenol pyruvate into oxaloacetate, which is typically the essential part of the gluconeogenesis, as all of you know very well. IgG, G is great, is the most abundant, not M. Shoot me one confident, correct answer, doctor. You are all going to be the physicians as recommended by the American Diabetes Society. Target LDL in a patient of diabetes. How much is that golden figure? Diabetic Ramaya, Bhimaya came to your OP doctor, what will you tell them? How much should be the LDL? If he is a non-diabetic Ramaya, Bhimaya, what will you tell? 100, 100, 100, 100. Amit, Vidya, Envy, everyone says 100, but I don't agree. 130 is very high, 150 is too high, 150 told by Kirti is very, very high. Come below 100. 80, aur niche. 50 is too low. So doctor, today only lipid diabetes chapter में target lipid values एकदम go prepared to the exam hall. Similarly, grades of hypertension, grade 1, grade 2, the Joint National Commission, JNC recommendations of how to define hypertension, how to treat hypertension. Forget about entrance, doctor, but these are the values which you need to carry throughout your life tomorrow, whether you are a gynecologist, dermatologist, rheumatologist, any ist. Now doctor, which amino acid is synthesized in the human body and it can be synthesized, but it need to be taken in the diet because it is not synthesized in sufficient amount. Typically methionine. Methionine also leads to homocysteine formation, which is very important for the tetrahydrofolate formation, as all of you know very well. That's right. I think the lone answer comes from Dr. Sumati saying it's 70 for our earlier question. Multiple myeloma is IgG, not the IgM. Allopurinol inhibits the xanthine oxidase, as all of you know very well. Now coming to the blood coagulation system, plasminogen is synthesized mainly by the kidney, not by the liver. Coming to the Bohr effect, what is the meaning of Bohr effect? Typically, if there is an increased H plus acidosis, then the hemoglobin starts delivering more oxygen with less affinity for oxygen. Hence, there is a shift of the curve towards the right, not towards the left, is what you have to remember. Coming to the sickling, deoxygenated HBS has more poor solubility rather than oxygenated is what you have to remember. Now tell me doctor, give me one confident answer. What is the most common cause of hypertension in young women and in young men? Who will give me the confident answer? Yes. Fibrodysplasia, as Amit says, more simple reasons, hypertension, young women. Everyone want to say fibromuscular dysplasia. A young woman who don't want children, who want to have little fun of the marriage for another 2 to 3 years before husband settles, earns at least 50,000. She also earns another 50,000. Then with 1 lakh, the Lakpati son will be born or daughter will be born. If they want to postpone, they use OCPs. That's right. That's right. The most common cause of the hypertension in the young women is the OCPs. And in the young men is ETOH. Nowadays people, young men are not smoking, madam. Young men are drinking more. So worldwide it is excessive ethanol and OCPs is what you have to basically remember. That's good. Now erythropoietic porphyria, patients are very much photosensitive. Porphyria cutanea tarda is basically because of uroporphyrinogen decarboxylase deficiency is what you have to remember. 12 ATPs are produced in a citric acid cycle. Why? When one glucose is, one acetyl-CoA is metabolized, 3 NAD, 1 FAD, 1 GTP. That makes it 3 3s are 9, 2 2s are, 3 3s are 9 plus 2, 11 plus 1, 12. Now coming to the porphyrias, cutanea tarda, the most common type. Coming to electron transport, The more negative redox, there is a lesser tendency to gain electrons, and more positive redox, greater tendency to gain electrons is what you have to remember. Where is he stuck on appearance? Give me one confident answer. Yes? Actinitic keratosis, very nearby answer, not a correct answer, but good attempt. Very good. Our Vizag students correctly answered. Seborrheic keratosis. Suddenly, if there are multiple seborrheic keratosis, what is when we stuck on appearance? You took little cow dung or a buffalo's dung and then hit to the wall. How it looks like that. Stuck on appearance. Seborrheic keratosis. If suddenly multiple seborrheic keratosis appear, what is it called? Sign of lesser Trelath is what need to be remembered. Sign of lesser Trelath, which is a sign of internal malignancy. Fatty acid synthesis starts with acetyl-CoA, and how is it transferred from mitochondria into the cytosol, doctor? In the form of citrate. So tricarboxylate transporter is the one which basically transfers it. Coming to oxidative phosphorylation, mitochondrial DNA mutations are 10 times more common than that of the nuclear DNA, is what we need to fundamentally agree. Now, azide, what does it exactly inhibit? It typically inhibits carbon monoxide, cyanide, azide. They all are the inhibitors of the cytochrome oxidase is what you have to ultimately remember. Now coming to pyruvate dehydrogenase. Pyruvate dehydrogenase basically catalyzes a irreversible reaction where the conversion of pyruvate occurs into acetyl-CoA is what need to be remembered. When fructose is phosphorylated by the fructokinase, it converts into fructose 1-phosphate, not 6-phosphate, is the point of interest here. Okay, doctor. Now, what is your answer for this? Cradle cap. Where do you see? What is the treatment? Cradle cap. Yes, doctor? Sarcoidosis is an answer from Siri and Vizag. No. Seborrheic dermatosis, rightly said by Dr. Madhavi, Kranti and Shweta. Seborrheic dermatitis, in the case of the newborn children, mother will come running to you saying that something wrong with my kid. It is seborrheic keratosis, dermatitis, not keratosis. Now, in SLE, what is the most common cause? They die. They die in the hands of a nephrologist. Renal failure, lupus nephritis is the most important underlying cause is what need to be remembered.